There have been a lot of stories in the news recently about disease outbreaks. Now, what's especially concerning for all of us, and to me as a public health person, is that many of these diseases actually have vaccines that prevent the disease. You know, some examples include mumps, pertussis, influenza, measles. Why? Why are we seeing more of these diseases? Well, simply put, fewer people are vaccinating. We need to figure that out. Let's look at measles for an example. Help us get a better understanding of this. You know, you may not know, but in 2000, the CDC actually declared measles to be extinct. Now, that was their word, that measles was no longer a cause for concern in this country. Wow. Because for most of our history, measles was a dreaded scourge of a disease. It killed millions, and it harmed millions more. Measles caused blindness, deafness, seizure disorders. Pregnant women exposed to measles all too often gave birth to children with serious congenital defects. You know, what's going on? Why are we seeing fewer vaccinations? I'm a law professor at a college of public health. My students and I learn the law by reading and analyzing cases. We look at the facts of the case. We look at the actions in the case. We look at the motivations of the parties, people in a case, why they did what they did. You know, cases are really just stories, and we all know the power of stories to help us parse out and understand complex issues. Maybe we can use that here. Maybe we can use stories to help us understand. Well, let me tell you a couple of stories in which many people chose not to vaccinate. In the first, a group of families was involved in a lawsuit because all of them chose not to vaccinate their children. Now, not for medical reasons, and they knew that in order to attend school, they had to vaccinate, but they chose not to. Various reasons. One said, you know, I read that vaccinations cause autism. Another one said, you know, I've heard from friends vaccines can cause disease, that they're toxic. One mom, when asked why she didn't allow her daughter to receive the hepatitis vaccine, she said, you know, hepatitis can be transmitted through IV drug use. And I have heard that teens who are given this vaccine actually begin to feel protected and may engage in that behavior, that very risky behavior. Additionally, she said, an angel appeared to me at the foot of my bed one night and said, because of that, do not vaccinate your children. Don't take that risk. You may be risking their immortal souls for all eternity. All health is public health. Now, what do I mean by that? Let me break it down a little bit, if I may. No decision we make about our individual health, the health and health care of our families, stops there. Those decisions don't live in a vacuum. They're not siloed off. No. Those decisions have impacts that ripple across our communities, across the nation, indeed around the globe. Vaccines are an incredibly effective tool. Indeed, I would maintain the most effective tool ever devised to address health and public health. Vaccines work. They're effective against preventing disease. Vaccines are also cost effective. You know, at this point, pennies per dose. Now, there are myths, lots of myths. You've heard them, we've heard them. Vaccines cause autism. Vaccines can cause the very diseases that they're intended to prevent. Vaccines contain toxic substances. None of this is true. A lot of research has been done to show this. There's another concept of vaccines that I want to share with you, and it's this concept of herd immunity. I find this almost magical. With herd immunity, in any given population, if you can get about 95% of people in that group to be vaccinated, 100% of the group is protected, including those who cannot be vaccinated for medical reasons. Let me give you an example of that. Another story. You may have heard about this. A little boy in Northern California was diagnosed with cancer at the age of 3. Can you imagine? I cannot. What that family faced. They immediately sprang into action and secured the very best care they could. And thankfully, his cancer went into remission. With that aggressive care, his cancer was not an issue. But unfortunately, a side effect of that very aggressive care was that his immune system was knocked out. That system that our bodies use to protect us against infectious diseases, for him was gone. Now, the community in which this family lived and the school that he was supposed to go to had a very low rate of vaccinations. Many, many families in that area chose not to vaccinate their children. He couldn't be vaccinated. In this case, fairly rare, the vaccine itself, because of his compromised immune system, could harm him, which meant if he went to school, if he went out in public, if he just went into the yard to play with kids in the neighborhood, he could be exposed to infectious diseases. Diseases that, if you or I were exposed, we may well not even notice. But for him, those diseases could be fatal. And so the parents made the only decision they felt like they could. They couldn't let him go to school. They couldn't let him go out in public. He couldn't be vaccinated. So they kept him at home. They kept him at home for years. He had to stay inside behind walls of plastic sheeting. He couldn't go out. He truly was a boy in a plastic bubble. That's not an urban myth. That happens. Now, let me be clear at this point. While I want to understand why those who choose not to vaccinate make that decision, I want to understand their motivations and what's driving that. I am foursquare in favor of vaccines and vaccine programs for all the reasons we've just talked about. Because of that concept of herd immunity, where 95% of people, by their decisions, by their actions, can protect 100. From 2000 to 2020, rates of vaccinations have gone down as the rates of infectious disease have gone up. We're doing something wrong. We seem to be going backwards. The path that we are on isn't working. We need a different path. Recall the families in those stories that we talked about. While they all made a decision not to vaccinate, those decisions were made for different reasons. And so you could say, well, they're very different. There's a real gulf between those families. Dive a little deeper with me. Are there common motivators that those families have in common? Is there common ground? I'd submit there is. All of those families, using the best information they had available, were trying to protect the health and well-being of their children. They all loved their children and just wanted to do what was best. even those that chose not to vaccinate, they're not bad people. They don't have evil intent. They're just trying to do what's best. So given all of this, what's my innovative solution? What's my call to action for you? Well, I wish I had a very detailed plan, a plan with all the steps I could just lay out before you today. But I don't. I don't know all the steps. But I do know, I'm convinced I know the first step. In these times which are so incredibly divisive, in which sometimes we seem to be in armed camps, we've got to begin learning how to talk to each other, not yell at those that disagree with us. We need to learn to empathize with others, not demonize other groups. We've got to figure out where that common ground is that we all share. Finding that common ground, finding those motivations are so important because there is evidence to show that people who have chosen not to vaccinate, if provided good, solid information from trusted sources, doctors, nurses, teachers, members of the clergy, when they're presented with that information, when they're heard, they oftentimes make the choice to vaccinate, knowing that it protects both their own family and their community. If we can do this, if we can follow this plan, if we can heed this call to action, what could be the result? I can envision a future where that little boy in the plastic bubble can go to school, can go out in the yard and play with his friends, who isn't stuck in that house behind the plastic curtains. But similarly, I can envision a future in which those who currently have chosen not to vaccinate are heard, not pilloried, that their viewpoints are listened to, which could then make them receptive to being educated about the power of vaccines. Every decision that we make impacts the entire community. No decision that we make about health or health care lives in a vacuum. No decision that we make stops with our own immediate family. They don't live in silos behind concrete walls. We are all inextricably linked together. And we have to learn to act together. My takeaway for you, what I'd ask you to consider as you leave today, is this. All health is public health. Thank you.